5 of the worst pains humans can feel? You're gonna wanna hear this. What is the absolute worst type of pain? I see it all the time in the emergency room. And believe me when I say treating them is no walk in the park either. Kidney stones, medically known as nephrolithiasis. Having kidney stones is unimaginably painful. And to paint a pretty picture for you, it's often compared to the pain of getting stabbed with a knife. And get this, it's estimated that 12% of Americans, for instance, will develop a kidney stone in their lifetime. Not fun would be the biggest understatement of the year. You see these small crystalline pebbles form in the kidney or urinary tract, aka the body's drainage system, for removing urine out of the body. Boy, are they painful. Usually made from either calcium, struvite, uric acid, or cysteine, they block the flow of urine, making the kidney swell and causing waves of sharp pain at the mid-back, abdomen, or sides.
Ow! My back.
And for dudes, pain at the end of their penis as well.
It hurts.
And that's not all, my friends. Kidney stones often result in fever, blood, and pus in the urine and vomiting. Once a kidney stone is confirmed, treatment with IV fluids and medication allows the stone to hopefully pass sooner rather than later.
Pass.
Now, when I say pass, I mean, yes, you basically have to give birth to this hard pellet via your urethra. Possible causes include not drinking enough water, obesity, weight loss surgery, eating food with too much salt or sugar or too much fructose. Infections and family history might all increase risk of developing kidney stones.
I got a kidney stone.
If you're one of the poor souls out there who's ever had a kidney stone, let me know in the comments on a scale of 1 to 10 how painful it was. Up next, trigeminal neuralgia. Often described as lightning hitting your face, trigeminal neuralgia is sudden attacks of severe shooting facial or head pain.
Whoa, insta headache.
That can be so debilitating a patient is unable to do anything at all while this excruciating nerve pain is happening. But what causes this severe shock therapy to the head? Well, when the trigeminal or the 5th cranial nerve is disrupted, severe types of symptoms can happen in people with multiple sclerosis, nerve compressions in people with tumors, AV malformations, which is a tangle of arteries and veins, or even perhaps because of a sinus surgery, oral surgery, stroke, or facial trauma. Did I mention that this extreme, sporadic, sudden burning or shock-like pain could even be set off by something as light as a gush of air or brushing one's teeth, and lasts anywhere from a few seconds all the way up to an hour or 2. And not to keep piling on the bad news pile, but there is no cure for it either, although it can be managed with therapy and meds. Number 3, giving birth. They say giving birth to a child is supposed to be one of the best days of your life. It can also be one of the most extremely painful sensations one can experience in their lifetime. Recently, reproductive studies came out and compared menstrual cramps to be as painful as a heart attack. Now, what if I told you that labor and delivery has been described as the most extreme menstrual cramps? During this time, one's uterine muscle starts contracting hard with severe cramping in the abdomen, back, legs, and groin area.
Her uterus hurts.
Tightening up, squeezing, pulling, and feeling like someone or something has just twisted your inside. It's not pretty. On average, this whole pain-filled process of active labor,
you have no idea how much this hurts.
could last anywhere between 4 to 8 hours, but some go even longer. This is not to scare off anyone from having kids one day.
No kids.
It's just to have an honest discussion about how painful and complex this process can be for an expected mother out there. Luckily, if a patient decides, there are ways to try and relieve some of the pain. Non-medication methods include trying different delivery positions, walking, warm compresses, applying counter pressure, breathing techniques, or for those who opt for it, there are pain medications and epidurals to help ease some of the pain. Let me know if you or someone you know has given birth and what their pain experience was like. Number 4, a broken femur. Speaking of babies, our next painful experience may make you cry like one. I think we can all agree that breaking any bone royally sucks, but breaking the longest and the strongest bone in your body, not something you would wish on your worst enemy. You see, your femur is located in your thigh and it runs from your hip bone all the way down to your knee, plus all the large arteries that run down your leg. Let's just call it a perfect storm for a bloody mess if you break your femur.
It was a bloody mess.
usually caused by some sort of severe accident like a sports injury or a car crash. When one fractures this area, you cannot put any weight on the injured leg, let alone walk on it. Any sort of movement to this area will actually result in immediate screaming. Also think of all the muscles that are attached in this area. Sometimes when a patient comes into the ER, we actually have to pull traction and yank the leg apart because of the amount of pain that the individual is in. Thankfully, it relieves a lot of the pain.
Pain is pain.
So what is the recovery process like? To be honest, it's long. 4 to 6 months, I'd say at least. And it's broken up in different phases with lots of pain management. You have to first set the bone back into its proper place with surgery to have some hardware put in it as well. And while the body is regenerating new bone growth and battling the inflammation process, we also highly recommend physical therapy to strengthen the muscles around the bone. If you want me to do a full video on the most painful broken bones you can experience, let me know in the comments below. Last painful injury you don't want to have: corneal flash burn. You know, when you've had a long day at the beach and your body turns red like a lobster, or gets so sunburned that blisters start forming? Imagine all that but put in your eye. I'd say it's excruciating enough to make a grown person cry, but honestly, crying only makes it worse.
Let it out.
The cornea of the eye is the clear outer part of the eye that helps your eye to focus light so that you can see clearly. Imagine a flash burn to the eye so bad it basically just singes it all away. Say goodbye to seeing for a bit and hello to eye patches.
On account of my eye patch.
Because bloody, pussy, and painful are only the beginning. Usually when I treat or see corneal flash burns in the ER, they are caused by things like welding torches, being exposed to too much bright UV light, lasers, tanning bed lights, sun reflection, even when skiing or snowboarding. Even looking directly at or near the sun, especially at higher elevation, can cause your cornea to burn as well. Your parents weren't lying when they said don't look directly at the sun for long periods of time. Now, here's the tough part about treating corneal flash burns. Just as your eyes sort of start to heal themselves, anytime a patient blinks their eye or opens and closes their eye, it basically sloughs off the healing layer that occurred, restarting the whole painful process. When we treat this, obviously we use artificial tears, medication drops, and pain medications,
Heavy meds,
to help prevent infection and to try to prevent your eyelid from sticking to your eye. In very severe cases, surgery may also be needed to repair the area. So remember, especially if you're welding or doing anything with a large amount of UV light, definitely wear eye protection. You do not want to have to come visit me in the ER with a cooked cornea, I can assure you. Now it's time to talk about how to actually manage the pain.
Wow, I'm Mr. Manager.
Obviously, pain is subjective and really depends from person to person and of course the severity of the condition, but if you are experiencing a medical emergency or sudden onset severe acute pain, go to the hospital immediately. If it's a chronic type pain condition that comes and goes over time, maybe seeing a pain specialist or a doctor that really knows the ins and outs of the exact ailment or condition should be considered. That way, you can get to the root of the problem rather than just masking the pain with, say, medication.
We all wear masks.
Don't give up on finding relief and please be proactive for your own health. All right, that's been a quick breakdown with me, Dr. Wagner. What's the most painful thing you've experienced? Also, what other excruciating conditions do you want me to break down and explain? Let me know in the comments below. Please make sure also you subscribe, turn your bell notifications on, and hit that like button. Thank you so much for watching and stay healthy, my friends.